Hello everyone and welcome to our physics presentation. Today's topic is about radio frequency ablation, RFA, done by Maha, Nouf, 12A.
Learning objectives. What is RFA? Procedure of RFA. How is RFA related to physics? To know the advantages and disadvantages of RFA. Relate RFA to the UAE.
Let's start with, what is radio frequency ablation? Radio frequency ablation, which is known as RFA procedures in medicine, are mainly used in cardiology for the treatment of cardiac disorders and in oncology for tumor treatment.
What is RFA used for? It works by passing electrical current in the range of radio frequency waves between the needle electrode and the grounding pads, placed on the patient's skin. These currents create heat around the electrode, which when directed into the tumor heats and destroys the cancer cells. In cardiology, the RF device consists of an ablator, catheter, RF generator and a control console 19. The energy-emitting probe electrode is at the tip of a catheter, which is inserted through a large vein into the heart. Ablation involves destroying small diseased parts of the heart muscle by means of the resistive heat due to the electric current generated by high-frequency RF waves in the catheter.
CT is used to guide a needle through the tumor shown. The prototype needle is called the Levine needle. One side is a plunger and it pushes out this array of needles that come out and curve around the tumor. It is a way to distribute the radiofrequency energy around the tumor itself.
Now we basically guide that needle into the back side of the tumor. We would deploy those wines and watch the tines wrap around the tumor. Using CT guidance, and once it's appropriately positioned, we put grounding pads on the patient's thighs and their legs, and we hook up the needle into a radiofrequency generator.
Relate to physics. Radiofrequency refers to the part of the electromagnetic EM spectrum bounded by the frequencies. Electromagnetic radiation includes, in addition to radio waves, infrared radiation, the visible spectrum, ultraviolet radiation, X-rays and Y-rays. In increasing frequency, RF ablation results in coagulative necrosis of tissue at high temperatures. The dipole molecules, mostly water, adjacent to the tip of the RF electrode, attempt to remain aligned in the direction of the current and are forced to vibrate as rapidly as alternating current is applied.
Radiofrequency ablation. RF energy is an alternating current with a frequency of 10 to 900 MHz. RF waves applied for tissue ablation have a frequency of 500 kHz. When RF electric field is applied to the body, the interaction loses in moving ions and water molecules at a frequency of the electric field, creating conduction current.
Advantages. It is minimally invasive with acceptable morbidity. It enables excellent local tumor control. It has promising long-term survival. It is a multimodal approach.
Disadvantages. Limitation of ablation volume. Technically invisible in some tumors due to conspicuity and dangerous location. The heat sink effect. In the UAE, the radiofrequency ablation uses high-frequency radio waves that stop the small sensory nerves from transmitting the pain signals from the joints, from the spine or other joints like the knee joint.
Our priority is patient care, and we offer the same high-quality, trusted healthcare, modern techniques and evidence-based procedures at our clinics in Dubai Marina and Jumeirah, as we provide at our internationally renowned hospital in the UK.